Good day, my people. It's your king, Aaron D. Wiggins, asking you, how are you doing during this quarantine for coronavirus? Do you have any goals? If so, list them down in the comments below. We should all be striving to become our better selves by picking up a new skill, hobby, body goals, or even a new boo. Anything to better improve your mental health during these tough times. Today's episode is another installment of Advice for Ignorant Leaders. It's one of my mini segments where I talk about influential leaders and policies that have made a lasting change in our communities. I believe that there is no such thing as an evil leader, just someone who doesn't know the impacts of their community and how they can drastically change things for the worse. So let's not talk about them. Instead, let's talk about influential leaders or policies that can be done to better improve our environments. In this AFIL, I want to talk about the many things we could be doing to better flatten the curve for the coronavirus that we aren't doing right now. 1. A nationwide mandatory quarantine. The federal government has made it a state's issue on whether it should quarantine its public or not. This has led at a late start for most of the states, flattening its curve. Other states like Florida and other parts of the countries have noticeably been having their public still open, and the places with high congregation, because parts of other parts of the country like New York, California were having quarantine, but other parts like Florida, Georgia, and a bunch of others, Alabama, were still having mass congregations at churches, beaches, and continuing life as normally as it is. This was terrible for flattening the curve for coronavirus, and it led to the spread of it. So when you quarantine, you can't just quarantine one area. You have to quarantine all of the surrounding areas, even if signs not be, there might not be cases in their county, but they're going to be cases in their state. You have to quarantine the whole area to make sure that one spread in that one city or county doesn't spread to a larger level. Number 2, producing protective equipment, or PPE. The Defense Production Act of 1950 allows the government to take control of the industrial powers and production powers of the United States to produce equipment. This was used during World War II to produce bullets and many other things for their soldiers. Yet, for the public health officials and nurses and even the general public, the ignorant leader, refuses to enact this act, and instead wants to work with corporations, allowing them to profit, allowing other states to be put into a bidding war for getting the protective equipment that is duly needed, and at the same time refuses to deal out other resources like protective equipment from its own federal reserves, and letting the states ask each other or fend for itself and making its own protective equipment. Number 3, testing. Do you know why the U.S. didn't receive any coronavirus testing kits from the World Health Organization? It's because we can take care of ourselves. The U.S. can produce enough ventilators and protective equipment and have enough medical testing centers for its own population. The poorer countries with less resources need help first. And even though the U.S. does have a low stockpile of protective equipment, that was nearly a decade ago. And it is a leader's responsibility to make sure that we are duly prepared and have enough resources for a public health crisis. After all, an influential leader has brought this country through 3 public health epidemics and and two of them were at home, and the majority of the public didn't know about one or all three of them. The early SARS virus of 2009, the influenza virus, and the Ebola virus were all public health epidemics. But this leader decided to get ahead of the ball by producing enough testing and having enough resources for the public to duly fight these epidemics. The U.S. has even already produced a better testing kit for the coronavirus than the World Health Organization has already have. Yet that doesn't mean that we shouldn't have used the World Health Organization's testing kits in the first place. That time period of us not having a test, but not using the available tests that are around, put the public in even more danger and allowed the spread to go even longer. Yet that's not enough. We need to increase our testing dramatically and to make sure that the curve can be flattened even more. Number 4, drive-through testing. A little side note, I have taken the opportunity to work at CVS as a shift supervisor and pharmacy technician, and it gave me the knowledge that the U.S. is going to start having drive-through testing, like the similar ones that they did in China, where drivers were allowed to drive in their controlled environment, their car, and be tested from a safe distance from a healthcare worker through a swab of the nose and seeing their test results. And within a short amount of time, they were allowed to know the results of their tests. Number 5, mobile testing and treatment centers. You might have noticed a mobile blood bank. Donate blood at your local college, movie theater, or in your neighborhood. Trailers are a great tool that we can use to help reach people without hospitals and testing centers, because the U.S. does have a huge disparity for the ethnic and poor people when it comes to public health services. Black and brown communities don't have the amount of testing and resources, or public health officials don't take the time to care about them as thoroughly as other communities. And lastly, do for your own. There are plenty of services that can be repurposed to better serve the community through this tough time. U.S. corporations like Instacart, Uber Eats, and other services can provide produce and necessities for at-risk communities that can't get out of their houses due to their own health risk. There have been some examples of even 3D printers being used to produce protective equipment and household items that can better help flatten the curve. We can always be creative and have our own resources or create our own resources to better protect ourselves. The idea of wearing gloves and masks is to prevent you from either inhaling in the coronavirus through the nose by wearing the mask or something to cover your face, or wearing gloves to prevent you from touching surfaces and thus touching other people or yourselves, allowing the coronavirus to get access through your skin. Although we may be quarantined to what I predict is probably going to be early or mid-July, there are tons of ways you can help recover from the coronavirus. There are different foundations that are giving out resources that you should check out below. And if you do have the resources to give back, you should, by donating to these foundations yourself. While you're there, you might as well follow us on social media, right? Facebook, Twitter, and Instagram all have our platform. You can find us by searching People's Health _ on Instagram and Twitter, or searching People's Public Health on YouTube or Facebook. Tune in to me next time, where I'll talk about all things public health. Till then, I'll be with the people. Will you?